Kia ora katoa, my name's Martin Chadwick, and it's with great privilege that I speak to you as the Chief Allied Health Professions Officer here at the Ministry of Health in New Zealand. How this role fits within the Ministry is that it sits alongside the Chief Nursing Officer and the Chief Medical Officer, forming the Office of the Chief Clinical Officers. That is part of the Ministry which is here to try to work on providing better services for the people of Aotearoa, New Zealand. It's been a privilege for me to be in this post for the last 4 months, and over that time it's allowed me to think a little bit about what can the contribution of this role be and how can Allied Health as a collective start to contribute more to the health and well-being of New Zealanders. So what I want to share with you today is what I see as the 5 challenges that Allied Health faces. Now, quite specifically, I'm calling them challenges because I don't necessarily have the answers within my role, but I also strongly believe that they are conversations that we need to have. So as I work through these challenges, I just really ask for you to reflect and to think about what can your contribution be, or what thoughts and ideas do you have. Now, the first is a question that I'm asked frequently is around how does one define allied health? And so simply to begin to build a taxonomy to start to look at those professions that quite clearly are registered under legislation, those that have got a very clear framework by which they are self-regulated. We have a very unique group which are legislated by law, and then a very large group that currently I'm using the term emerging. Emerging insofar as that there are criteria you can use to look at a profession. That first they must do something, they've got to have a training program, a body of knowledge, be organised in some way, have their own internal standards and ethics and complaints processes, and they must have an altruistic intent. So within that component of emerging, to begin to ask the questions, where does a group sit as they begin to mature into true professionals? And a part of that is to begin over time to build a dictionary, for want of a better word, to be able to articulate who is allied health within Aotearoa, New Zealand. Challenge number 2 is to be able to better articulate what is the value add of allied health as a workforce grouping. What I'm trying to socialise with that is the concept of utility. Within healthcare, we pretty much will always spend the money that is given to us, but there is always a choice that goes along with that money. And how do we best use that money and gain the greatest utility by using allied health more in the choices that are made? So with that, there's the ability to say that we can provide more services for the same outcome, or we can provide a greater outcome for the same level of resourcing. But how can allied health begin to engage much more forcibly in that discussion to say that this is the value add that we bring? And then from that to begin to articulate how can others begin to do and build upon the success of others, to build toolkits to help others to in turn be able to put what has been a new initiative in place. The third challenge is probably one of the most necessary for New Zealand, is to begin to work through the issue around equity. Looking at the allied health workforces is that we graduate a workforce that is not proportional to our population. All credit to our medical colleagues. They have over the last 7 to 8 years worked within the medical schools to now graduate proportional to our population. So what do we need to do collectively to get to a point where we are graduating students that are proportional to our population? How do we ensure that students in high school understand the breadth of options that are available to them going into the health field? That it's more than just Shortland Street, that they too can be a play therapist, or they too can be a psychologist, or one of the many other professions that fall under the allied health umbrella. Within that, how do we ensure that our workforce is that they are competently safe and that they grow in their cultural competence as well? To ensure that we ask the most important question first of all when dealing with a person. What is it that matters to you? What do I need to take into consideration when we begin our therapeutic encounter? So how do we work on that cultural safety and that cultural competence within our workforce? The fourth challenge that I see is a very crowded health landscape between employers, our tertiary partners, our unions, our professional bodies, and our regulatory bodies. Understanding that each has got a unique contribution, but to get to the point that we have a clarity of understanding that what is the unique contribution that each group has to make, where is the space which is highly collaborative between groups, and where is shared space between all of this, and within all of it ensuring that we do not lose focus of the people that we're here for in the first place. Now, the last challenge that I'll put out there is around the concept of transdisciplinary working. To put this into a context, interdisciplinary working is where you have professions that are very much focused within themselves. Interdisciplinary working is where you have professions that may operate on a referral basis to each other. Multidisciplinary is where professions may come together around a common cause but still operate very, very singularly in their focus. Transdisciplinary is where there is the ability for groups to come together with an understanding what is their unique and special skill set that they have to offer, but also with the understanding that there is an awful lot that is shared between professions. It's not about competition. How can we get to that point where we can come collectively with an understanding that there is much that can be done across professions, and the literature will tell us that that only strengthens one professional identity. So to be working in a transdisciplinary way, that it's not about competition and defending, but rather about how do we come together to ensure that we're delivering the best care for the people of Aotearoa, New Zealand. So what I've tried to articulate very briefly are what I see as the initial 5 challenges for allied health in particular. What I'm seeking to do now is to think about what can I do within this role in order to try to move some of those challenges into actions. But I'm very curious and interested to know what that means to you and what your thoughts and your ideas and your contributions can be. So at the end of this presentation, there will be my contact details, and so I encourage you that if you fall within that allied health umbrella, please put your thoughts down. I'd love to hear them.